why the topic is a valuable one, and why we should be thinking about what we should be thinking about gaining from this course. So, as I mentioned, I am a physician. I have studied a bit of Islamic law, but I run a program at the University of Chicago about Islam and medicine. And as professionals in the sphere of medicine, I think we all know, we're all here because we face challenges in thinking about what the right thing to do is and how we ought to practice medicine. And when we think about our tradition and being Muslims, we immediately come to realize that there are points where we are called to do things from our faith, or because we want to live out the values that our tradition has, but we don't know how to do them in the sphere of medicine. So I think that's the general experience that many of us probably come towards, brings us towards this class. But taking a step back, I think for all of us, I would like to share a couple of things about the general notion of the relationship between Islam and medicine. So taking a step back, let's think about for a moment what medicine represents and what Islam might represent and how they might intersect. So one, I think if you think about medicine and Islam both as cultural frameworks, you'll get to see that there are points of connection and points of disconnection between both. So what do I mean? So as a physician, and I assume many of us are either students of medicine or are physicians, if you think about what we do every day in medicine, you'll notice that we attach meanings to things that we do that only the people within our sphere understand. That we use a certain type of vocabulary, and that vocabulary only the people within our sphere understand. So medicine has a particular vocabulary that transmits value to people, for the patient and the provider. So for example, when I say I prescribe something, or I give medical orders, or I do certain types of things for patients, I say you should do this or do that, that vocabulary conveys the meaning only within that group. When you think about Islam, when we talk about certain things in Islam, they simply only have meaning to Muslims inside that sphere. And I think this concept will be explained in a second when I give you an example. So within medicine, when I talk about, as a physician, that I'm going to prescribe you medicine for pneumonia, a person who doesn't understand, when I say we're going to prescribe you something for pneumonia, the notion of what pneumonia is only understood when you understand the basis upon which people diagnose diseases. Right? There's an underlying structure that pneumonia represents some sort of bacterial infection in someone's lung. If I were to say that to a person on the street who doesn't know anything about medicine, there would be no content that's communicated. That pneumonia has no meaning to them. And when I say I am prescribing you, I am taking something, that relationship between myself and the patient is one that is understood as between a doctor and a patient, that a patient should follow what the doctor says. And that the patient should follow what the doctor says, that the doctor has some authority over the patient, right? That in order to be a good individual, or in order to get healthy from a disease state, that the patient should understand that they should follow the doctor's orders. That same structure occurs in Islam as well, where you have certain authorities, and those authorities are trying to help individuals. And the meaning communicated by that between the authority and that individual is only understood if that person is within that cultural framework. So the simpler example would be, and today you're here for that reason, you're here to speak and listen from a scholar of Islam who will teach you and advise you about things about medicine, or about fiqh, in this case about fiqh of medicine. And that to be a good Muslim, that you should follow what they say. So you see that in medicine as well as in Islam, there's an authority structure. There's a vocabulary that is used. That vocabulary and that authority structure only has meaning when it's within the context of that same group. So in medicine, it is about the healthcare system, it's about patients and doctors. And in the Islamic framework, it is about scholars of Islam, they're practitioners of Islam, and our goals are in medicine to get healthy or help people to get healthy. And Islam is to help people gain salvation. So you see there's a similitude there, an analogy there between the system of medicine and the system of Islam. and there's a vocabulary and authority structure. There are other similitudes as well, which will now draw out some conflicts that might arise. So in essence, both Islam and medicine are meaning-making systems. That there are ways upon which medicine is built. There are ways of knowing in medicine, and there are ways of knowing in Islam. There are ways of these ways of knowing can conflict or can be the same. So, for example, taking the pneumonia example, I mentioned that, and we all understand that there might be a bacteria that causes some sort of symptoms, that leads to some disease that requires some treatment. Now, the fact that I think, or I believe as a scientist, that there is some small organism that can lead to some sort of symptoms in an individual, and that symptomatology will lead to symptomatology will require some sort of treatment, is all based on a certain type of understanding, a certain type of data, right? And the person who wants to take the treatment must take at face value that that system of unknowing is one that is true, or at least mostly accurate. The same thing could be said about Islam, right? That in Islam there's an epistemology, that there's a way of knowing, and that for someone to be an adherent of Islam, they have to believe in that way of knowing. So in medicine, we all understand, we all believe this germ theory, we all believe that bacteria cause disease, we all believe that we give people antibiotics and their own immune system will then fight off that disease, right? But not all of us see the bacteria, not all of us, the patient doesn't have to see the bacteria to believe that there is some cure in it. The patient just has to rely upon the authorities and the scientists in this case who have done that research. But we know that every step of that research in some way might have some inaccuracy, that there's a built-in lack of certainty potentially within each one of those structures, right? So is it this bacteria? Does that bacteria cause all these symptoms? Will that medicine 100% cure? We don't know, but we take it on quote-unquote faith because we believe that that way of knowing, that way of understanding is a valid one, and that the implications of that upon us as patients, the implications of that we should act according to that scientific system so that we can get cure. Again, the same thing can be said about Islam, right? That the way of knowing what Allah subhanahu wa ta'ala is, where Allah subhanahu wa ta'ala's pleasure is, and where his displeasure is transmitted to us through the Quran and the Sunnah of Rasulullah and is interpreted for us by scholars of that tradition, right? And that way of knowing, wahi versus empiricism, that we believe that wahi is a higher form of knowledge and deserves more, in case matters of fiqh you'll see as well, is something that we take on because we believe the end result for us salvation depends on believing that the way of knowing is one that is accurate and certain, that the interpretations are not certain in the sense of 100%, but has a dominant probability of being true. So we take that on faith and we take that on belief so that we can get the action. The implication of that is that we will gain salvation because that system of knowing, that way of knowing, is one that is valid. So in this way as well, both medicine and Islam, if you think of them as cultural frameworks, have ways of knowing and ways of understanding that have implications on the person and the individuals who are following that cultural framework or participating in that cultural dynamic. So in the case of Islam, it's scholars and interacting with wahi that will allow us to have some understanding of where God's pleasure or displeasure resides, and upon that we will do actions that will help us gain salvation. For the patient, or in this case even the physician, we believe that there's a way of knowing of how bodies work, where disease is, and how illness comes about. And because of that, we will do certain actions, take medications or surgical treatment or other modalities of treatment so that we might help people become healthier. Now, if you think of both Islam and medicine as epistemological frameworks, then you will notice that there might be conflict at times between the tradition as we understand it And what medicine as a scientific system, as a cultural production, believes is the way to do certain things, or what is the reason behind certain things. So one example is the one I just shared with you about medicine, about pneumonia. As scientists, as I said, we take it because of our knowledge that society has gained, that we've participated in producing, that there is a bacterium that causes some sort of symptoms in someone's lungs, that leads to the diagnosis of pneumonia. At the same time, we know our tradition tells us that Allah subhanahu wa ta'ala sends down diseases and their cure. Now, one might say these don't have to conflict, right? But if you think of them as separate systems, then you have two different explanations for why someone is feeling ill. One that might say it is an intervention by the divine, and the other that say it might be because of a bacteria in someone's lung. And why I'm bringing this example up is that while the common person might say, well, this doesn't have to conflict, there might be people, and I know from my own research, who might feel they do conflict. Because one might say, well, if the disease is one that's sent by Allah subhanahu wa ta'ala, then my recourse should be to just pray. And the medical doctor would say, well, prayer is insufficient. You must also, you should take medicine. And then the learned individual might say, well, why don't you do both at the same time? The point being that for us involved in trying to understand the intersections of Islam and medicine in our practice, as in our actions as patients or as physicians or as other allied health professionals, we must come to understand how to integrate these bodies of knowledge so that we can act in accordance to both. And there might be in times when they conflict perceivedly, in an elementary sense or on the surface level, in the example that I gave you, where you can just resolve it by saying, well, look, everything happens in this world because Allah subhanahu wa ta'ala permits it. There is no inherent conflict. And we can think of it as an integrative system. At the same time, there might be times when they do truly conflict, not in just how a disease is perceived or produced, in this case, ontology, the reality of what is happening, but in the fiqh lens and what the cure demands of you, right? We might say that the certain types of healing are ones that are prohibited or are seen as not effective within the tradition. And let me play that out for a moment. If the way theologically to get healed is to petition Allah subhanahu wa ta'ala for healing, taking the hadith that Rasulullah tells us that in Allah anzal da'wa wa du'a, a little late this morning, but anyway, that he sends cure and disease, that we'll learn today. It's in Bukhari, so we will review that in this class. That if we believe the way to get healthy is to attract a divine cure, divine attention to our plight, that perhaps if we were to use means that are declared to be that are prohibited within the tradition, that would not be the most effective means of seeking treatment for our ailments. It won't be the way to attract divine attention to our plight. Right? So it will come in the chapters that we read in Bukhari about the notion of where you can treat with the haram, right? And there will be hadith about this, there are instances about that. But if you think about it from a theological lens, that why someone is becoming ill is because Allah subhanahu wa ta'ala is testing them or trying them, that Allah subhanahu wa ta'ala sent down some ailment for them, that if you want to cure that or relieve that, then there is a debate on whether you should use something that is considered prohibited or not. Because if the cure is simply Allah subhanahu wa ta'ala is lifting that ailment, then perhaps using something that He has declared to be filthy or to be inappropriate for Muslim use would not be the effective means, right, to get His attention. At the same time, medicine might say, well, that is the cure, because we know that there is some bacteria or something else that will be treated most effectively by this sort of chemical or this sort of medical treatment. So there again now, because you think of both of them as systems of explaining what is happening to individuals, as systems of conflict. And in this realm, I believe the science of fiqh is particularly helpful for us, within the fact that we have a plural tradition, a vast scholarship of trying to understand wahi, right, which is the means through which Muslims understand where God's pleasure is and where God's displeasure might be, and how it explains all of the realities around us, not the ones that we see. That there might be conflict between those two systems of explaining how things come about in the world, and indeed how to be in the world. So the other lens, so thus far I've been speaking about epistemology and ontology. Epistemology, ways of knowing, how we know something, why we think something is happening, the rationale and the basis of knowing, of knowledge. And ontology, what is actually the reality of what is occurring. But the third realm, which fiqh touches upon to an extent but not fully, is the realm of ethics. About how to be in this world in the most virtuous manner. That would be from a quote-unquote secular definition. If you want to Islamicize it, how to act in this world such that you are acting in the way that is always consistent with God's pleasure. If you want to put it in an Islamic moral theological terms. Now that system of ethics, right, how you ought to do something in the best way, is one where in the tradition of Islam and in our medical specialties can be different. Right? They can again align or not align. So for example, for many of us who are studying medicine or are physicians, our ethics, the ethics that we learn in medicine, have to do with virtue ethics on one hand, right? Being trustworthy, being honest, having prudence, and we learn about the virtues. And it has to do with, oftentimes, the most dominant system is the 4 principles of biomedical ethics by Bouchard and Childress, that think about these meta-ethical values of respect for autonomy, beneficence, non-maleficence, and social justice, that seem to be values around which physicians should, or values through which physicians should adjudicate the ethical within their practice. Right? So to have a relationship between a patient and a physician, how should the physician act? Well, medicine will, the system of medicine will tell us that the best way to act would be to act in a way that is consistent with respecting the autonomy for a patient, of doing no harm, non-maleficence, of physician beneficence, acting in accordance with what is best for the patient. And the 4th, social justice, so that now you're thinking not just about the patient, but the larger society, that we act in an ethics of caring for larger society so that we deliver medicine in a just way that does not discriminate, right? And again, this is, I'm sharing with you just an elementary view, but one might say this might be the way that we're taught. And that at the same time, we should inculcate in our practice virtues, right, of being honest, trustworthy, so that the patient can have confidence in our dominant motivation being to help them get healthy and to care for them despite all the other challenges that occur in our practice. So the cultural production of contemporary medicine tells us there is an ethical way of being, that this is the way that you should be to be the best of physicians, to be the most noble of physicians, to be the most ethical of physicians. And it tells us how not to act, right? Because that would be contrary to the best, to the goals of medicine, which is to help individuals to flourish, to be the best that they can be, to be healthy. So, for example, from the virtue perspective, lying would be a way that is contrary to forming stable patient-doctor relationships, right? To discriminate, right? To give medicine that we know has more harm than benefit. These would be ways that are contrary to being the most ethical of physicians. Now, in this, as I said, this is an ethical system that comes out of, right, a value system that arises out of society, because medicine places itself within society, and societies have certain understandings of what medicine should do and shouldn't do. But also comes from a tradition of medicine, right? A journey of medicine, meaning if you want to truly connect it to medieval medicine, to Hippocratic medicine, that there is a continued line of understanding of how best to be a physician in the science of healing, right? Which was different, obviously, 50 years ago, 100 years ago, 1,000 years ago. But you can connect that historically, that caring for individuals, that the profession, quote unquote, of medicine is one that comes from olden times, ancient times, and continues to today. So that the ethical understandings from Hippocrates, for example, many of us think about the Hippocratic oath when we take the oath to be physicians. We might take a Muslim version of it, but in any case, the fact that there are some ethical values within the Hippocratic oath, which is very, very ancient, right, that still have relevance for how we practice medicine today, tells you that there's a continued lineage of understanding of how to be the best physician, of the ethical values of medicine. Now, in parallel, hold Islam in the same way. That to be the best Muslim, right, is a continued exercise of understanding how the value systems within our tradition resonate, how they can be applied to today and to the professions of today. That we have some sources of knowledge, again, the Quran and Sunnah, the prophetic practice, right, that have and indicate for us values of how to be ethical, how to be in line and accord with God's pleasure and displeasure, right, to be the best Muslim, so to speak. That continues to today, and trying to understand how to do that in the context of today's professional spheres. Right? It is not a closed science, meaning it is not that it occurred once in time and that's everything was delineated. So many of us might be familiar, for example, with, often people quote Ruhawi, right? Ruhawi, 12th century physician, and his Adab al-Tabib, right? So that we might quote these texts from old time. Say he wrote a compendia that helps us understand the ethics of being a physician, and we're done. And that would be an accurate statement, because society, as society develops, we need to have ethical guidance that is relevant to society today. How medicine was delivered in the 12th century is not how medicine is delivered today. The understandings of what our responsibilities to society are at that time might have been different than they are today. So that in continuing the understanding of what is ethical is a journey that continues to all time and for all spaces, and your sources, right, give you indicants, dala'il, right, of how to do that. Now, holding Islam and medicine in parallel in the ethical way, as I said, that there might be some overlap with fiqh, but it is not full. Right? So we know in our tradition that fiqh is a science that has moral content, but it is not the only science. Right? That fiqh is not the sum total of how, it doesn't tell us the sum total of how to be the most righteous of individuals, the one that is most within God's pleasure. So for example, one might say, fiqh might tell you what is permissible and not permissible, what is mandub, what is something that is rewarded, but if you do not do it, then you are not held to account. So fiqh might tell me I can do something today, right? And a non-medical example, let's take the example of fiqh might say, yes, you can marry today and you can divorce tomorrow, and you can marry to the day after and divorce the day after. Right? It might tell you it's within the realm of permissibility to do so. But the person who acts in that way, who marries today and divorces tomorrow, and marries the day after and divorces the day after, there would be something that if an observer was looking at them and say, this is not really ethical. This is not really the way to be in the world. Right? But the person might respond, well, fiqh-wise, it is sufficient. So, but our tradition isn't, our tradition, the moral content of our tradition does not simply reside in fiqh. There are other things that help us understand how to be the best person, how to be the best Muslim in this world, right? Where akhlaq, right? The sciences of fiqh also, the science of ethics also involve the sciences of ilm al-akhlaq, how to be, right? There's also tasawwuf, how to actually be virtuous, how to live your life as one that you are truly envisaging Allah subhanahu wa ta'ala in all your actions, and to be bearing that in mind, in the forefront of your mind, that I want to do only those things that gain Allah subhanahu wa ta'ala's pleasure, not simply those things that are permitted, right? So within the context of Islam, there are other sciences that help us think about what is the most righteous way to be, what is the most ethical way to be. And just as in medicine, so there, just as we talked about in terms of ontology and epistemology, there might be conflict, or there might be areas of non-alignment between what medicine considers to be ethical, right, and what our tradition, or at least in this case fiqh, that's the content of this course, tells us is the most prudent way to act, the one that is most aligned with divine pleasure. So again, taking the example that we started off with about the notion that you might not want to treat the things that potentially are prohibited, this would be where the ethics of a physician might be in conflict. Should I, for example, an individual who desires to science or to relieve themselves from the suffering of being in this world? They might say that. They say it in different ways, but they might say that. And the physician's charge is to help relieve suffering, even the suffering, if it's existential suffering of being in this world, right? Or being with too much pain. How to live and when not to live. That the most ethical of physicians will be the one who helps individuals when they are in certain terminal conditions to relieve themselves of the suffering of being in this world. But that might conflict with notions from our tradition of Allah subhanahu wa ta'ala being the one who has written when people die, and that individuals who bring about others' death are culpable morally for murder or homicide, right? That to be the most ethical and righteous of human beings in the light of Allah subhanahu wa ta'ala, in His eyes, to be the best Muslim, is one who does not take upon themselves, save for specific circumstances, the action of bringing about another's demise, another's death. That the most ethical there, the most righteous there, is not a person who does that. So here again, you might see a conflict if you think of them as parallel systems between what the moral values of our tradition are, right? And what is seen as the most ethical way of being in our tradition, and what medicine might call you to do, and how it envisages itself as its goals, its ends, that one might consider to be the most ethical physicians in certain areas. So as you can tell, I'm giving an ad hoc lecture here today because dear Mufti Saab is unable to make it due to technical difficulties. But what I was trying to communicate in this last 20-30 minutes is this relationship. If you think about medicine and Islam as cultural frameworks that have ways of understanding the world around us, ways of explaining the world around us, and ways of thinking about what the ethical actions are in the world within us, how we should be. And if you match them up, you will find in many areas that they are aligned. But there are areas where they do conflict. And you can actually chart out and map out where they conflict. And then where they conflict, that's right. There's not just one fiqh. There's fiqh that's continually updating and understand honing itself as a science, right? That practitioners of fiqh, the muftis, right, and fuqaha are continually applying and understanding better. That science of fiqh helps us to navigate those areas where there might be epistemological conflict, meaning that there might be different understandings of what is occurring from an Islamic lens and a medical lens, where there is ethical conflict, where medicine might call upon individuals to act in a certain way, but our tradition might say those are contrary to the values of the tradition. And in the ontological realm, where the trueness of something, right? What is actually occurring is understood differently from the tradition than from science, right? So for example, and the clearest example, the last sentence would be, what is, as a scientist, what am I told happens at the end? That our body, right? Someone dies, their body decomposes, and their science tells me nothing after that. That the end of a human being is as dirt in the earth. But our tradition tells us that it is not the end. Rather, that is now the beginning of a true life, right? So even in the ends of understanding where we're going to be, science, or in this case biomedicine, and our tradition may have different views on that. So I believe, and why I think all of you are here, is to better understand where and how the wahi, right, the sources, the ultimate source of knowledge for our tradition, helps us to navigate those challenges. And particularly looking at the course outline, that we were going to be dealing with Kitab al-Tib within the Sahih Bukhari, right, which gets us to the Wahi Ghayr al-Matlu in this case, the Sunnah, the Hadith that we have, the recorded Hadith of Rasulullah Sallallahu Alaihi Wasallam in that bab, but those Hadith have implications for the science of fiqh, and in this class we will then, inshallah ta'ala, be talking more about those implications. So I hope Mufti Abrar, that this foray is sufficient to help students engage with this course. I'm happy to field some chat box questions if you'd like, but inshallah, I hope I've filled in sufficiently for the moment.
Jazakallahu khairan. Alhamdulillah, we are very honored that Dr. Aasim Padela Sahab with us. If anyone would like to ask any question regarding Islamic bioethics, he can ask through chat box.
So one of the questions that was asked here from Asad to all of us is this notion the conflicts, where there are conflicts, and I want to underscore that in my reading and understanding, those conflicts are the minority of times. But when there are conflicts, in between rock and a hard place, that there might be duties and responsibilities that in one aspect of our identity call us to do, but another aspect of our identity suggests that you should do something else, right? That we're always trying to figure out the best and navigate, right? And so the conflicts I think you're talking about are the conflicts between medicine and what medicine will call you to do and what Islam might call you to do classically. Well, they're resolved as they're resolved today, where individuals who feel that they're perceived there is a conflict, they would ask an authority about that conflict and what they should do, and then they would try to develop accommodations around that. So an example might be, well, okay, you know, I am conflicted about whether or not I should give this certain treatment or whether I should act in a certain way. And then the physician in the olden times and today might say, okay, let me ask a jurist about that, whether or not I am able to engage in this practice or to provide this sort of treatment or not, or whether this sort of treatment is part and parcel of medicine, right, or not, or should be part of medicine. And that authority would give a response, whether affirming that no, this is okay to do, or saying no, perhaps you should not do that, because your salvation might be at risk, meaning you might sin. And then that practitioner put myself, quote unquote, in jeopardy, but at the same time might allow individuals to